Welcome to the Less Invasive podcast. This is another episode, and today I'm very happy to have Anthony Sebaaly on the show. Anthony is a clinical application specialist. He has 4 years experience in the medtech space and especially in medical imaging and surgical robotics in the Middle East and the Africa region. So today there is a lot of buzz in the surgical robotic space around what's happening in the US, in Europe, and also in Asia. And we don't hear that much what's going on in the Middle East and the Africa region. So that's why I'm very happy to have him on board because he can talk about that, having spent some months and years implementing a surgical robotics program in this region. Anthony, welcome to the show.
Thank you, Lucian. It's a pleasure, actually, and I'm glad I had this opportunity, and I'm participating with you in this podcast, which you started like few months ago. I believe because I'm following you since 2 years, and I saw your projects, and now you launched this podcast project. So I'm very glad to be with you as well.
Thank you. So, to start with, could you briefly outline what is your background? I understand you're a biomedical engineer, and what has been your journey in the medtech space, and especially in the surgical robotic space, up to where you are today in Dubai, in a distributor for various surgical robotics companies.
Yeah, actually, exactly. I'm a biomedical engineer. I graduated from the Holy Spirit University of League in 2018. So this has been my fourth year in the field. I started with a company distributor for GE Healthcare imaging systems, as well as intuitive robotic surgical system Da Vinci in Lebanon. I started my career actually in ultrasound, and then I switched to robotics after just 3 4 months, where I got the opportunity to participate in the technical training on the Da Vinci and for intuitive, as well as the clinical training in the same year, and it was almost in the beginning of 2019. So yeah, after that I started implementing this the Da Vinci surgical robotics program in Lebanon, and after 2 years I had the opportunity to go and support the distributor team in for Da Vinci in South Africa. I spent there 2 months and a half for that project, and then when I came back I relocated to Dubai. Now I'm the clinical application specialist for various robotics platforms, as you said, with a company called Robotic Surgical Systems. We're covering Dubai, definitely UAE, and the region. We cover for the three various so far, various surgical robotics products. One for CMR, which is the Versius surgical robots, the one for Siemens Healthineers CorePath, Corindus, and the third one is for BHS Technologies, which is called Robotics.
Wow, that's great because you are touching various specialties in laparoscopic surgery, obviously with the CMR versus system, but also endovascular space with the core path, and also digital microsurgery with the robotic scope. So I may have a few questions about that later, but my
Definitely.
second question would be: I just read your LinkedIn profile, and you state your mission or your purpose, that is to ensure that surgical robotics will become the standard of care in your region. To strive to achieve this goal and all over the world. So I definitely feel that you have this passion for surgical robotics. So where this passion comes from? Do you remember when it started and why?
Yeah, actually, I started in the university. The first time I heard about robotic surgery and about Da Vinci, and in Lebanon, it was a bit of a secret, this robot that has been in the OR, no one can see it, especially when we were biomedical engineers in the university, we used to go for an internship in hospitals, and they used like to say, "No, don't go in the OR. You can't see this robot." And it was for me like a secret. I want to know this robotics platform, and then I started in the university participating in robotics competitions. I remember that very well. It was just a robot that plays with balls and throw. The competition was is an international competition, and I remember that we get qualified to the US to participate in the World Championship robotics competition, and the robotics passion started then, and then after I graduated, I worked with a company that are the distributor for Intuitive in Lebanon, which is general medical equipment. And as I told you, I started with ultrasound. Then I knew at some point, because I have on my CV that participation in robotics competition, I'm gonna reach a point where I'll be working with that Da Vinci finally, this secret surgical robot in Lebanon, and I get the chance. And yeah, it started there. And with robotics, the the mission is always to change, and I love that. And that was one when I created my own mission and my own purpose in the healthcare field, because I love that field. That's obviously that's why actually I did the biomedical engineering degree. So because I love that field and it matches with the purpose of surgical robotics. So my mission was, yeah, from now on, I'm gonna work and try my best to improve the patient lifestyle, and not just the patient lifestyle. We're working to improve surgeons' lifestyle, because the difference between laparoscopy and robotics, especially in soft tissue robotics. So yeah, since then I started. That's my mission, and that's what I'm gonna do. I started on a national scale in Lebanon, and then I evolved myself to the regional scale. That maybe we're gonna talk about it later.
Yeah, yeah. I mean, the difference between national and regional, we will study this later for sure. So, I mean, that's a great mission, and I also myself try to promote this kind of assistive technologies whenever they provide benefits to the patient and or to the surgeon. So I understand that you went under quite an intensive training on the Da Vinci, then on the CMR versus system. I think it's both a technical and clinical training that you have to go through, and first for the surgeon, you are training the surgeon, and it must be also quite an intensive training. Could you talk a little bit more about that? How does the training work for such a complex system that is a teleoperated robot with a console, two, three arms, 3D vision, a lot of technologies that the surgeon has to operate? Could you take us through the training journey for the surgeon?
Yeah, sure. Honestly, for us, because we want to train surgeon at some point, so we were trained like we were a surgeon. So we had to go through all the steps that we have to share with the surgeons later on, and we have to train them on them. So definitely, we had to do suturing. We had to operate on the robotics platform using the surgeon console. Each robotics soft tissue robotics platform has a surgeon console, the patient card connected to the patient, and the vision card. So we had to go through all these details, and because I had the opportunity to do the technical training as well with on the Da Vinci, so I know almost the product from the small screw to the whole thing, and the post uh, clinical like procedures that the surgeons does. So actually, yeah, we always try to, because it's a new technology for the surgeons, especially if they're coming from a laparoscopic background, and if they are very professional and expert in laparoscopy, they started when you come to them with robotics, you have a different technology. First of all, surgeons has been studying for many years to achieve this point, and then you're coming to them and telling them you have to study again, because it's like studying a new technology, studying a new technique, dealing with new instruments, the dexterity of the instruments, seeing another vision they're not used to see it in laparoscopy, working from a from distance from the patient. So all not feeling the tissues, all these things matters for them. So that makes the pathway, the clinical training pathway, that's what we call it for the surgeons. So it makes it much longer than if they want to start with laparoscopy, So we start with every steps. We start sharing like videos, clinical videos with them. We ask them to observe the robotics procedure so they can see the workflow, how we dock the arms, where we put the surgeon console, how they can see the vision card, how they can communicate with their assistant. Because in these kind of cases, the surgeon is not connected to the patient. He's not scrubbed even. So he's on his surgeon console. The assistant is doing everything that's needed, like suction, irrigation, or needling, or inserting in mesh, all these kind of things.
Yep.
So you have to you have to go with them through all these steps. Then we start doing with them simulation, so training on a simulator which takes hours. After that, we start doing with them training on phantoms, and then cadavers, and then like you have many steps for them to be able to sit on a surgeon console and start doing procedures on patients, because the purpose and the aim at the end is the safety of the patient. So before achieving that point, they have to go through all these steps that we're not going to go into details about, but this is mainly and in brief what we do.
Okay. Okay. And so I think they get certified at the end. I hope so.
Yeah, definitely. Definitely. They get
So
certified by the company.
So I have an additional question because I saw you recently got certified on a robotics cup from a BHS
Yep.
company. That's because I'm kind of attached to this digital macroscopy field because actually the very first version of the Rosa robot was holding
Yep.
cameras for being a digital microscope. It never really took on the market, so we moved on to biopsy and then deep electrodes insertion, and now it's more for functional neurosurgery. But that was the very first option that we have designed at the time with a 3D headset and stuff like that. And my question would be, I would guess that the surgeon training for this kind of product that is the BHS robotics cup, basically a robot holding and moving a microscope, a 3D microscope, would be much lighter and quicker than a complex teleoperator robot. Is it the case, or do you go through all those steps also with this system?
Yeah, you're totally right. That's exactly it. Actually, with the BHS Technologies robotic scope, uh, as it is a scope, it's not connected to the patient, so
The
it's
patient,
not
yeah.
going to harm the patient or do anything. Then the training on that technology is going to be much faster, honestly. Especially that like surgeons used to do for microsurgery and ENT surgery, plastic surgery, they used some of the procedures, they used to use a normal microscope. So
Yep.
the idea behind that scope is to make the surgeon sitting comfortable, okay, and then by just moving his head up, down, right, and left, the microscope will move, and it will provide a better vision, 3D vision definitely as well, and it has some features as well that they can't find in a normal microscope. And this was the idea behind designing the BHS Technologies robot. That's what we learned in the training, actually. So they created this robot to adapt the microscope on the surgeon's body, not the other way around. Usually
Okay.
in
Yeah.
normal
Yeah.
microscope, the surgeon has to always look in the binoculars, and his neck is going to be flexed and he's not sitting comfortable at all. So they studied their ergonomics, and even you can see in their pictures that there is a big difference between using for the surgeon between using a normal microscope or using a robotic scope like this one.
Yeah. Okay, yeah, yeah. I mean, I understand that, and I think the first episode of this podcast was also to bring optics into spine surgery, minimally invasive spine surgery with the max view system, and that was the same, solving ergonomics issues and being able to display what the surgeon is viewing when he's operating to the whole staff, so that they can know what he's doing and anticipate which kind of instruments he will be using and stuff like that. So I think in the endoscope, microscope, scope space, yeah, there are things that technology can assist in, better economics, better visualization, and better communication between the surgeon and the team. So coming back to those more complex teleoperated soft tissue robot, um, I've seen that you were part of the project of the first robotic surgery in Jordan that happened in Amman. I think it was in January this year, and it was some kind of a big event because the procedure was also teleproctored with the Proximity system, so that a system that enables a surgeon in UK to interact with the surgeon in Jordan and give maybe explanations, get all the videos, all the information, all the views of the operating setup, and to be able to help or to answer questions. So that was a kind of a big event. So my question would be, what do you do, Anthony, when you have a new site like that? It's the first in the country, or it's the first in a new hospital. How do you prepare this kind of introduction of a surgical robot in something that is never done before, either in a hospital or a new country?
Yeah. You know, I always say as a clinical implementation, you have a huge role to play because you're always in the field. So you watch surgeons, you watch the program, you watch the teams, how they work. You speak with the management, you speak with the OR manager, you speak with the CSSD, all the parties involved in the OR, you know. So I played that role actually. And as a clinical implementation, you have two roles to play, either operational, so to make everything smooth and going in a perfect and efficient way, or let's say as a consultant to enrich the hospital with the information and the knowledge you have to make sure that the first surgery that is going to happen is perfectly done. And that was a challenge for me because, and I wanted to start with this project, especially because it's the first soft tissue robotics platform in the country. So that was the first procedure. And as you said, it was proctored remotely, but using Proximy, which is an amazing platform where you have many features that helps you to do that. And unfortunately, with the COVID situation, we faced a lot of trouble and challenges to make and convince the surgeon to come to Jordan. So that's why we approached Proximy and they were very supportive. And you can see in the OR where you put the laptop, three cameras, one on the surgeon console, one on the patient, one on the bedside unit, and you take the screen for the proctor of the surgical view. So, like, the proctor is with you, but he's not in the room, you know? And it helped a lot. The first procedure was done perfectly as well. It went very well. And in the end, what matters is the patient. The patient is good, doing very good after it as well. So you play the role of all these things you have to manage before the first case. The CSSD sterilize all the instruments that you want to need during the procedure. You have to talk with the management. You have to talk with the surgeon how to set up the arms because this is one of the main role of the clinical implementation where you have to standardize the procedure cards of your bedside units to be able to avoid any clashes during the surgery. And this is one of the challenging things we have in the OR that we work on it to make the surgeon happy, you know, and that's what we want in the end. We want that the surgeon finish his case and say, okay, I'm comfortable on this, especially that this is his first surgery as well on the technology. So we want to motivate him to work more because we know that this robotic surgery platform has many advantages to provide to the patient, and it's going to change the patient lifestyle in the future. So this is what we have as a challenge to make the procedure like go smoothly and
Mm.
perfectly with no harm to the patient and having the surgeon happy in parallel.
Okay, good. I mean, that's a great story, and that's a lot of technologies, and I'm happy to see that
Yeah.
countries such as Jordan and other countries in the Middle East and North Africa get to have those kind of technologies in some of the best hospitals, I guess, in the countries, and then maybe more of those hospital that will be installed along the next few months or years, and we hope that this technology will spread into also this region. So when once you've done this first training for the surgeon, you've done the first case, now you've done maybe 10, 20 cases, and it's more a routine use of the product. How much support and additional training is required for from the clinical application specialist for this kind of soft tissue robot? Is it like always ongoing or on request? How does it work?
Yeah. Uh, as I said before, we have a role. The main role is to actually make the surgery smooth, and we have to like ensure that this is going on until like after 10, 20 procedures maybe. But each time in the like in urology or gynecology or general surgery, you have a new procedure to try. So having a new procedure for the surgeon requires you to be in the OR. So maybe after 10 to 15 procedures, the surgeons and the team, if both are good, you can leave the OR, but your availability in the OR plays a good role because you want to build a successful program. You're not just targeting a surgeon when you're a clinical implementation, you're targeting a program and you're targeting many specialties. And I believe that the only place where you can meet new key surgeons is in the OR. So that's why
Yeah.
our presence in the OR doesn't stop on just supporting the surgeon. No, we have to continue to search for key surgeons to be able to add them to our robotics program and make from this investment a good one because they're investing in this program and this robotics platform to make all the specialties and all the surgeons that works in urology, gynecology, and general surgery involved in it. So yeah, this is mainly so we support 15, 20 cases. The surgeon is good, the team is good, we're satisfied. We start going on a monthly basis, maybe, or on a weekly basis once to see what's going on with the system, what's going on with the surgeon, who are the new surgeons that can be involved in our technologies, and so on and so forth.
Okay, thanks. I mean, I understand that, and it's kind of a continuous support every time there is something new or something, some issues happening. You really want to be there, to be present, to anticipate that, and be able to really, as you say, make the surgery as smooth as possible for the customer to be happy with this technology. And so now I understand what's the role of a clinical application specialist in one country, and you mentioned that you moved from a national to a regional scale in your different roles. Could you tell us what's the difference in your job managing one or several countries? Do you go less in the OR? Are there different skills? What's the difference?
Yeah. Mainly, what's the main difference is the culture, because in each country, every OR has its own rules, its own regulations, especially in the Middle East. Like some of the countries wants you to do that, some of them don't want you to attend all the cases. So even that's not
Mm.
on a regional level, that's on a national level. Each hospital has its own
The
rules and
preferences.
regulation. But when you grow more into regional level, culture mainly is the main difference because you have, and that's what's exciting as well, and that's what's challenging and what gives you more confidence because you start to deal with people from all over the region and surgeons from all over the region. So yeah, much more challenges, but it's much more exciting.
So, which countries are you covering right now from where you're based in Dubai?
Right now, we're in Jordan, we're in Dubai, we're in Pakistan and Egypt, and we're having many more in the upcoming few months.
Okay, okay, cool, cool. All right. So I think what is really specific around your profile is that in such a short period of time, the fourth year that you are doing surgical robotics, you've touched several different platforms. So you've worked with as a distributor for a kind of a well established, mature technology that is the Da Vinci. That was the first version was cleared in 2001, and a more fast growing startup like CMR Surgical with the Versus robot that is more a modular solution. So, could you tell us what are the benefits of those two, having worked for those two companies and for those two products? What did you learn with, providing support for those two different systems? I mean, coming from two different companies.
Yeah. You know, from my experience with both companies, both distributors for these companies, actually, uh, with the previous technology, Da Vinci, I learned and I grew. However, with here in this job now I'm doing, I'm growing definitely, and I'm contributing. So
Okay.
this is something that makes me more excited because I'm contributing with the experience that I have. I'm aiming to contribute to this company to change and improve and improve and improve until we reach a level where this is the standard for surgical procedures. So this product has to be used in all the ORs and all the and that's actually one of the main purposes of CMR, which is making robotic surgery accessible for all patients all over the world. And that was one of the things that I'm working on now. We're growing, we're contributing, and we're aiming for better and better lifestyle for the patients and the surgeons.
Yeah, I mean that's yeah, interesting because both Proximi and CMR have the kind of same mission that is to provide access to all. I mean Proximi through a telehealth platform and CMR with a more affordable, probably and a modular system that and targeting regions that were maybe less targeted by intuitive surgical at the time, and that's great to see those kind of two technologies having a success or being utilized in the Middle East and Africa region.
Yeah.
So thank you for. I'm almost ready to do a clinical application specialist job in surgical robotics, but so now we'll come back to maybe more question on you, Anthony. So you are from Lebanon. I mean, it's kind of a small country that is between, Syria on the north and on the east, and um, and Israel on the south. And this country has been through kind of a rough time. I mean, on a political and economical crisis those past few years. So I wanted to just ask you this question: how would you describe Lebanon, your country, to people who've never been there, like me, and the Lebanese culture?
Yeah. Yeah, Lebanon is a small country, definitely, but I ensure you that it's one of the most beautiful country in the world. So
With friends.
yeah, with friends, definitely. So this country that has four seasons, you can see the mountain, the snow, the beaches, the lifestyle, the nightlife. Everything is amazing, honestly. And as you said, it has been through a tough time the past few years, which unfortunately made me relocate to Dubai to continue growing, because at some point, you want to grow more and more, and you reach a level where you're stuck in your country, so you have to upgrade yourself in another country. So yeah, uh, actually, sometimes I see this is definitely not a good situation in Lebanon, but sometimes me and my friends in the country, we always say actually that this situation help us as a Lebanese to always aim for growing, so
Mhm.
you don't get stuck in a place. Because our country situation is like that, we started searching, working more, improving our CV, expose ourselves more, improving our network, work on many projects, all these kind of things, to never stop at a point, because you don't know
Mhm.
what's going to happen tomorrow. So let's do our best, to be able to overcome any challenge that will happen tomorrow. And that that's actually what makes us always thriving to work more, to improve ourselves. So at some point we can, okay, we have a situation now that we can do anything for it. So let's evolve ourselves outside our country, and maybe one day we return back and we work on all with all our experience in the country itself and improving it back again.
All right. I think improving yourself. I think I fully agree with that, and that was also one of the takeaway during the first episode with Jay Pendleton. So, a lot of people in this space are sharing this kind of mindset, and I feel that the Lebanese culture, maybe due to this situation and the geography of the country, would you say that entrepreneurship is something that is rooted into the Lebanese culture? Because it's like Lebanese people, they tend to start businesses on their own much more often than maybe other cultures, I would say.
Yeah, yeah, I totally agree on that point, especially that we used back in university, me and a group of biomedical engineers, to always think about that, because in Lebanon, the entrepreneurship word is very famous, and it's now courses in every university almost, and then they push you to reach a point where you work on your own, and you create your own project, you create your own company. So all these, as you're saying, so it's very attractive word in Lebanon, and every youth now is just aiming for the future to have his own startup, and some of them are working right now on them. I have a lot of colleagues, Lebanese colleagues, that are working already on startups, and they're successful at our age, so
Yeah.
which is very good as well.
All right. Thanks for sharing a bit of your culture and of your country. And I think uh, together with entrepreneurship, there is something that I remind that you told me about how you get your first job, maybe through LinkedIn. So I had this question around, why. When did you started this activity that you have on LinkedIn on social media, and why did you started it, and how what do you get from this? Because sometimes people are asking themselves, why should I go to LinkedIn, what should I do there, and what for?
Yeah, honestly, I received this question from many of my friends as well. Why you
Okay.
are that active on LinkedIn? What's the reason? And all these kind of things. So honestly, I started with the exposure on LinkedIn once I saw that the uh, robotics surgery is a is the two words that no one of my friends knows about. When I talk to
Okay.
my friends and I tell them, do you know what? No, actually, when they ask me, what do you work? And I tell them, they start thinking, whoa, what are you doing? Are these even existing? So I started doing that. And this is one of the things that we aim in robotic surgery now, is the patient awareness. We want the patient to go to the surgeon and tell him, I want to do a robotic surgery. It's not now an option, or just, we don't want to make it only for the surgeon to propose. Is it lab? Do you want to do it lab or open or robotics? No, I want to do it robotics. and that's the aim. That was actually the first purpose of my exposure on LinkedIn. Then when I get like a lot of views, I got exposure on my posts and all these kind of things, started exposing more and more my posts and exposing myself as well, because in the end
Yep.
this is a tool where you can expose yourself to surround yourself with a network that is in the same field. And that's why I use LinkedIn, and I would love to share things about any robotics platform I work with. So I don't know if that's your purpose as well, because I'm gonna ask you
Yeah.
the question later on. I'm
Okay.
saving that question till the end, but actually,
Okay.
this is what makes me not only to show myself or what I'm doing. I want to show every one that is interested, either a surgeon or a biomedical engineer or a clinical nurse that who wants actually at some point to be working with a company as a clinical implementation, what a clinical implementation does, what the robotic surgery means, and how can you grow through LinkedIn to have more network and expose yourself more to the society, especially when connecting and surrounding yourselves with all these experts in this field.
All right. So I mean, that was my last question, but as I know that you will ask me a question back, I will ask another one, so I have time to prepare my answer. So
Yeah.
people sometimes they understand the purpose, they understand the benefit, but they say, hey, I mean, this must takes a lot of time. So how much time does it take you to work on this? How do you do that? I mean, is it like when you're in the train or in the plane or waiting for the surgery to start, and how do you manage to do all that together with all the work that you have to do for implementing surgical robotics program in the region?
Yeah. You know, I don't have so far. I don't have a plan to share something or to post something. I share everything that is interesting and could help people know more about the product that I work for or the robotic surgery in general, and how the surgical, like the world of surgery, is going to be in the future, which is super exciting for me. I don't know others if they see that thing, because they're not all my connections are related to this field, but actually when I post, that's when I share. When I post, actually it comes naturally, like
Okay.
I'm just working or doing something, and then I see this is gonna hit the LinkedIn now. So I take a picture, I just prepare the caption at night while just lying on my bed. I prepare the caption to that post that will make that post beneficial, and that the caption will explain what's behind this post, exposing the product, yourself, and the hospital you're working with, the platforms you're working with, and that's mainly the aim. So when we finished the first procedure in Jordan, we mentioned the hospital, we mentioned the platform that we worked with, that we mentioned Versius, which is the robotics that we use. We mentioned the surgeon. So we mentioned all the team that is involved in this project to share that history or that story with the people to know more about what we're doing.
Yeah, thanks. I understand. I fully agree. This kind of spontaneous posting is I would say rather easy to do once you have the mindset of okay, this could be a good story for social media for other people for a good reason. Obviously, it's not just for talking about yourself. And you take a couple of pictures, you write down a couple of paragraphs, and then you just mention whichever companies or a physician or employees that have been part of the project, and it can be like just a 5 or 10 minute 10 minute work that you can do any time in the day when you have those 5 or 10 minutes. So thank you, Anthony. I've asked all my questions, so now is the part where you get the opportunity to ask me your question that obviously you prepared.
Yeah, actually, I was about to ask you the same question, because I've been following you on LinkedIn for almost 2 or 3 years now, and I was always interested in your post as it enriches me, and it keeps me up to date with what's happening in the market, especially because I'm passionate towards this field. And I found someone like you doing the same, you know. So, but I can see that your projects and all the posts that you prepare, these posts need time, definitely.
Mm,
So it's not
mm.
like me where you can just I take a picture and I see that it fits LinkedIn and then I'll share it. So that's why I wanted to ask, and I would love to know what's the purpose and what are you aiming to achieve after being involved in all these activities and projects, especially that lately I saw in your post that you're doing more LinkedIn posts, Wednesday posts, podcasts, which I'm following you, by the way, and I'm watching them all, and TikTok nowadays, the trend on the social media. So yeah, that's what I wanted to know. What's the purpose and what are you aiming to achieve after all, like
Yeah,
after
I mean,
being
yeah,
that active?
that's a good question. That's a question that I also ask myself sometimes, I must say. So basically, as you've been following me for quite some times, I've been not a regular, not regularly posting for a while, just posting occasionally some stuff, and that was just to uh, raise awareness and because I'm very curious. I've been working 20 years in surgical robotics. I'm still passionate about all these technologies and beyond, teleproctoring solutions, surgical navigation, augmented reality, virtual reality. There are a lot of cool technologies that can help the patient and the surgeon. So I'm always happy to share that kind of information. But basically, I think it was mid-April last year. It was kind of between in the pandemic. I kind of observed that the I believe that we are shifting from the conventional marketing and communication to a much more digital one, and there have been an acceleration due to the pandemic situation, and now people are consuming a lot of content through digital, being website, but more social media, podcast, and even TikTok right now. So I decided to okay, I think this is a big trend. This is the future, and I want to basically raise awareness on this kind of new technologies that provide benefits to the patient. So that was just not really an objective, but like a north star that I started with in April last year. And I mean, I figured things along the way. So I started with more regular posts on LinkedIn, obviously, and I was doing a lot of text and post with images, and then slide decks, carousels, and then more of that, and then I did summaries for the monthly reviews, and I got a lot of feedbacks. And when you are engaged into a social media, it's a social activity, and basically. Social activity means you interact with people and you get feedbacks from people like you and people like other dozens of people that say, okay, I like this, I don't like that, and then you adjust the content because I don't post for myself, I post for other people to get value from what I give, and it's kind of a snowball effect, and then after that you are one step further, and you like maybe I'm a bit Lebanese culture. I want to grow. I want to go further, and so once I went. I saw that the LinkedIn was kind of something I started to knew what it was all about, and I saw those podcasts. I also feel that this is a strong trend for the next 5 years that companies are starting podcasts, and even in surgical robotics, in the medical imaging space. So I know that this is some skills that will be valuable in the future for me, for my company, for anybody I work with. So I just decided to okay, I'll use this new channel to do the same. I mean, just to raise awareness in surgical robotics, and I extended to minimally invasive surgery because that those two are sometimes strongly related, and I want to keep the clinical side of this, and then what's LinkedIn, podcast, and the new trends is obviously TikTok. And right now I didn't really start it on this platform because I need more time, and there've been some kind of troubles in Ukraine with Russia that kind of disturbed my mental space for quite a few weeks. So I just put this on hold, but I know I will try there, and maybe it will work, maybe it won't. And I mean, we'll see. And I will only have the answer if I try. So I will try. I will try
Definitely.
someday. And what I get out of this is just it's just enormous. I mean, I give a lot, obviously. I give a lot because I provide information to people. I summarize stuff, but I also get a lot of connection with people like you, with people like all the people I've doing a podcast with. And when you network and you connect to people, then you have opportunities for partnerships, for knowledge, for other stuff, and it's you get way more than what you give. So that's what
Yeah.
I my conclusion of my social media activity right now.
Awesome. That's incredible. Honestly, I can't be like I'm so happy I'm having you as a connection. Honestly, since the first time I connected with you and I was enriching myself, as I told you, with new information because this field is growing a lot, and you know about
Yep.
that. And because you summarize us with many news, so every time I see your summary at the end of the month, I start, okay, this company is doing that. This company is doing it. So, your posts are very informative for people who are interested in that. And that's something honestly amazing. And it helps us a lot to know what's going on in the market, how we can grow in the field more and more. So, honestly, hats off and thank you for doing that for us.
Yeah, I'm happy. I'm happy if it works because in the end, it's to serve the same purpose as yours. And I mean, if whatever I do can help in to some extent bring those kind of technologies in the Middle East and the African region, then I mean it's good for everybody because we need this space to be working well, and so for this space to be working well, we need educated people that understand what
Definitely.
is surgical robotics, what are the different technologies, what are differences, how they provide benefits, so that they can really train better the surgeon, educate the patient, and get the results that we want to provide with some improvement. All
Absolutely.
right. Thank you, Anthony, for being a guest of this episode of the Less Invasive podcast. Hang on a minute, we will have a little chat, and so this is the end of the this episode. Thank you all for listening to the episode, and see you next time.